we on? Why don't you go ahead? Okay, we are on.
Well said.
Good morning, everyone.
Good morning.
Welcome to the Monmouth Regional Chamber of Commerce, Chambercast. How's our speakers doing? Okay. Little reverb there. Thank you. Thank you very much. Appreciate everyone being here. What? Okay. My name is Terrence Wall. I'm very thrilled and humbled to be the host with three fantastic guests, incredible. And we're looking forward to, for anybody who listens to Audible at 1.5 speed, you're going to get a 1.5 podcast. We're starting a little bit later, so we're glad you're all here. We're going to get through some tremendous information, news that you can use to save a life from this podcast, and I assure you it's going to happen. The American Heart Association, I believe, is celebrating a 100-year anniversary, I believe so. And what they're involved in doing is helping train the next generation. We're just handling a little bit of bear in mind. I'm going to keep talking regardless. So if you are interested in the content, please, we're streaming live as well. So share with your friends news that you can use. So I want to thank Ralph Sumner and Bellworks and his team at Inspire, making this dream come true right here in Homedale. Go to bell.works to follow what they're doing. Also, shout out to the sponsors. We have Genesis Orthopedic and Spine with a new location right here in Middletown. Thank you for being here and sponsoring. And also Epicare Home Health Services as well. I'm going to be introducing in a little more detail after we go around the room Dr. Peter Farrugia, Dr. Georgios, Giannakopoulos, and Jim Schatzle. You know, it's interesting. When folks, I'll give you a word, calcium. When you think of calcium, what do you think? How many think it's a glass of milk, maybe? Calcium, right? How many think maybe cheese, perhaps, a little calcium? I'm looking around Centrum 50. No? Well, when you leave today, you're going to think of calcium in a different way. You're going to think life and death, and you won't be able to unhear it. Calcium, life and death. And we're going to get into that topic with the incredible people that are here today. So with that, Jeannie, I'd like to go around the room real quick, but also the sponsors to share their stories so folks know who you are. So if you have that portable mic, we're going to do that, and then we're going to jump right into it, folks. Thank you for being here.
Okay, first we're going to talk to our sponsors. Thank you for being here today.
Thank you for having me. Good morning, everyone. My name is Michael. I'm the owner and registered nurse with Epicare Home Health Services. We are a concierge long and short-term care company. With our short-term care, we can do respite care and we can do post-operative care. So for respite care, you may be taking care of a loved one and you may need a break. Let's face it, caring for someone is not easy. So for a break, I will come in, whether it's a day, whether it's a week, whether it's a month, I will come in and I will take care of your loved one for that period of time. And then for the post-op care, whether you're going for ortho, GI, even plastic surgery, people don't realize that plastic surgery is still considered a surgery and the recovery can be lengthy. I will take you to your procedure, I will speak to your physician or your surgeon, I will get doctor's orders. I will take you home from your surgery and I will care for you for the amount of time that you need. And then for long-term care, we can do skilled nursing and we can do personal care services, which are your activities of daily living. Not everyone can walk, not everyone can prepare a meal for themselves, not everyone can shower, so we can do all those services. And all of our care is provided by nurses. We don't use any certified home health aides. We use all nurses. Me being a nurse myself, I am not only the owner, but I also do the care myself.
Thank you very much for sponsoring the chamber. Thank you. Genesis Orthopedic.
Hi everyone, thank you for having Genesis. My name is Lindsay, I'm the marketing specialist here. So we are very excited to have our first office in Monmouth County in Middletown, and that is our fifth office in New Jersey. So we are a full-fledged orthopedic and sports medicine group. We have 5 providers that can see you for anything from head to toe, literally, because 2 of our providers are some of the top concussion specialists in the state of New Jersey. And so we see anyone from the age of 5 to 85, and some of the things that our patients really love about our practice is how our providers come up with super personalized treatments for all of the patients. They have great manners in terms of minimally invasive and really listening to the patients, and we want to keep growing, keep expanding. So if you're having any sort of joint pain, you know anyone that's having joint pain, concussions, hips, knees, ankles, spine, come see us.
Thank you very much.
Okay, so we're quickly going to just say our name and the organization that we're from.
Hi, I'm Therese Rolke, Executive Director of the Monmouth Regional Chamber of Commerce. Thank you all for coming.
Thank you.
Good morning, Ted Matoro, Executive Director of Monmouth NJ 250. We're preparing to celebrate America's 250th anniversary in 2026.
Congratulations.
Yeah, thank you.
Gary Gelman, Gelman Images, serving Monmouth County and the state for 35 years.
Bonnie Preston, I'm a certified insurance counselor, Conover Buyer Associates, Monmouth County and all around the region. Thank you.
Gilda Healy, Healy Brokerage, from Niagara Falls to the shores of Cape May, we've got you covered.
Oh, thank you.
Russ McKeever, Connections Unlimited, doing business for over 25 years and also an active Monmouth County public historian.
Thank you.
Hi, my name is Paul Thurston, T-Marketing. I do marketing.
Thank you.
Good morning, Caitlin Miller, President at Bayshore Medical Center.
I'd like to thank Caitlin for being here, having the team of Bayshore and the folks that are directly involved in the healthcare community out in the community making a difference is incredibly important. So thank you for you and all of your team for being here today. Appreciate that.
Hi, I'm Dr. Youssef. I'm the Vice President, Chief Medical Officer of Hackensack Meridian Bayshore Medical Center.
Welcome aboard, and thank you as well.
Morning, I'm Marissa Medina, Executive Director of Bayshore Medical Center Foundation.
Thank you.
Good morning, Jared Logan, Go for Hire. We do career services and staffing, so we help local businesses build out their teams and workplace cultures.
Hi, I'm Daniela Reiner. I'm a life and career coach with Ironbound Coaching.
Hi, good morning, everyone. My name is Diane Robertelli. I'm here with Sports Care Physical Therapy.
Good morning, everybody. My name is Beth McGovern. I'm a registered nurse. I am the hospital and physician liaison at Care One at Wall, and we're celebrating our 20th year in Wall, New Jersey.
Yeah.
Chris Carroll from Brookdale.
Hi, I'm Elena Wharton. I'm a freelance writer at Tap Into.
Hi, Teresa Marsh. I'm the marketing assistant at CSAV Systems.
Al Aloisi, your independent insurance broker and pianist and tennis coach and whatever else. I don't know.
Our Renaissance man. Thanks, Al.
Piano is his forte.
Hi, I'm Valerie Khalil. I'm a junior at Homedale High School looking to start cardiology internship in the fall.
Hi, I'm Aiden Marrera. I'm also a junior at Homedale High School, and I'm looking to start an internship in sports medicine.
How you doing? I'm Elliot Cohen, the business education teacher at Homedale High School and the internship coordinator.
And just a note on Mr. Cohen, thank you so much for being here. The interaction with all the local school districts is incredibly important, bringing in the next generation. The students are here every month, generally, and also have excellent questions, and they bring that back to their peers in their districts. So thank you for being here.
Good morning, Russell Gartz, Collier Youth Services. For nearly 100 years, we've provided residential, educational, and summer camp programs for under the poverty line and kids who have suffered severe trauma.
And they have their big fundraiser coming up on the 29th, right? Thursday.
Hi, I'm Mary Giannakopoulos. I'm an interior architect, but more importantly, I'm the proud wife of Dr. Giannakopoulos and a proud mom of our 3 children, Maria, Dimitra, and Dimitri. Thank you.
And a lifesaver.
Yes, yes.
Yes.
Good morning, I'm Erin Farrugia. I'm Director of the Mid-Level Practitioners at Advanced Heart and Vascular of Central Jersey. I am also Dr. Farrugia's boss and wife.
Isn't that the same?
We also have 4 children together, Samantha, Vincent, Brianna, and Thomas. So happy to be here today.
Yes, and the food collection today for healthy food is an initiative of their daughter Samantha's as part of her business academy, right, at SJV, St. John Vianney High School. So you must be proud. We have the food over there. Thank you.
Thank you, everybody.
I'm Jeannie Wall, and I'm owner of Tap Into for a lot of the Monmouth County towns. Thank you.
Thank you. And again, Mary and Aaron, thank you so much for being here today. Being a part of your family, it's your team, and often they see things that you don't. And so that's a critical component of successful life, successful work, and successful family and home. So, you guys ready? You ready to go? How are we doing so far? Good? Dr. Peter Farrugia. Dr. Farrugia is an interventional cardiologist and vascular specialist, just named recently as top interventional cardiologist of the year. His private practice is Advanced Heart and Vascular Central Jersey, located in Colts Neck. We've got Colts Neck in the house, that is for sure. Dr. Farrugia spent 8 years working for Barnabas Health Medical Group, functioning as the Director of Outpatient Vascular Medicine and the Chief of the Cardiac Cath Lab at Monmouth Medical Center. That experience has helped him develop an improved concept for care delivery. His Advanced Heart and Vascular Center of Central Jersey focuses more on the physician-patient relationship, including, you would talk about changing our relationship with food. Very notable. That always stuck with me, how important that is. The core principle serves as the why behind the creation of his practice, and he lives in Colts Neck with his wife Erin and their 4 kids. So I'm going to move right on. Dr. George Giannakopoulos, an old friend and really one of the most fantastic doctors in the area. He's an infectious disease doctor, saving lives every day, just like Dr. Farrugia, with a specialist and a practice based in Homedale. Cares for patients with infections that are often difficult to diagnose and treat and can be life-threatening. And just getting through this pandemic, I can't even imagine the amount of hours that you put into that, risking your life and helping others and saving their lives. So thank you for that. It's incredibly important. As an infectious disease specialist, Dr. Giannakopoulos works to prevent, diagnose, and treat a wide variety of infectious diseases. He also educates patients traveling to places around the world, not just here, not just in Homedale, not just Monmouth County, around the world, that have high rates of infectious diseases, and lives in Colts Neck, as you know, with his lovely wife, Mary, and their kids. Jim Schatzle, when I was a volunteer member, I don't even need to read off of that. When I was a volunteer member of the Homedale First Aid Squad, I served for about a decade, and it was always, what's the ETA and the medics? What's the ETA and the medics? You know, 1861 to Homedale, what's the ETA and the medics? And there was a call at one point, there's a pediatric call that we're on. I was BLS, and Jim ran with Monarch as paramedic. And can I tell you, one of the most thoughtful, experienced, talented paramedics in the history of Monarch's operation, bar none. I know that it's true. I've been on the calls with Jim, and the level of care that he gives patients, including this pediatric patient at that time, who was stabilized, expedited to a hospital, and was fantastic, went very, very well. But it was a part of that care continuum and the handoff between the BLS and the ALS, and then getting to Bayshore in a timely fashion and making sure their team is there. But really life experiences, and that's what we're gonna segue right into today, because just like life zigs and zags, kind of like a normal or abnormal sinus rhythm, right? So will this podcast. What we're gonna do is talk about a story that Dr. Giannakopoulos has that emanates from a recommendation from his wife that I referenced earlier. What does calcium mean to you? Well, it's going to mean something for some of you. You know this already, but for so many people and your friends and family, they have no clue what calcium scoring is, what the reference to it is, and how it truly is a difference between living and dying, and what we can do now as opposed to being towards the acute phase, which Jim Schatzle is going to talk about as president of Team Life and his team of folks that are educating and communicating advanced life support and getting certified to provide life-saving resources. And the next big thing I already know we're going to hear about in a little while is this incredible toolbox that you have, but we're going to talk about AEDs, automatic external defibrillators, and how that is now right down to everyday people. It could be right in your car, right? You know, it should be at every location, every public location, but how you can make a difference and you can save a life. And we're going to be talking about that too. So let's come back now, if we can, with a personal story. Now, you're involved in saving lives. Can you chat about how your life itself was saved, and also when you went back to work, how you ended up helping communicate to your peers and the follow-on of helping them save their own lives?
Thank you. And Jeannie and Terrence, thank you for putting this together, and for everybody for showing up here today. And actually, I always thought my story was very unique and individual, and I would go around telling people, but the more I tell people and the more I hear about them, actually it's a very common thing. My wife said not to make a big deal about this, and since you got a microphone, she said, keep it short, don't sit there for 2 hours talking, because I like being on a microphone. So I'll make it simple, 45 minutes, so just sit back and relax. Like Terrence said, what is the calcium score and what does calcium mean? Everybody thinks of their bones, milk, and everything. I'm a physician. I do infectious diseases. Like Terrence said, with COVID, I had more friends than I ever realized in my life who would call me up after 30 years trying to figure out what they should do. We love helping people. That's why we went into medicine. But sometimes doctors, we forget about ourselves.
We're always the last.
Really take care of ourselves. My wife, who said not to make a big deal out of this, and I promise you I will make a big deal out of it. One day we were sitting home and she said, my sister told me about a calcium score. Do you know what that is? I'm like, I heard of it. A lot of my friends are cardiologists. We talk around. Yeah, I know what a calcium score is. She goes, we need to go get one. I looked at her and go, yeah, okay, that's nice. What are we having for dinner? And get the cheese out and get everything going. That being said, never paid attention. Now, also, I was 57 at the time. I'm 58 now. I was on a treadmill and I was on a stationary bike for 35 minutes a day, my heart rate up to 120. I never had one symptom. The only thing I have history-wise with regards to cardiology is my father's side, every male died before 60 years old from a heart attack, my father at 55. Other than that, my cholesterol was minimally elevated. I was on Crestor, 5 milligrams, which is nothing.
But you are a man and you were over the age of 55.
True.
Risk factors, folks.
And he'll get into all that technicality. I'm just giving the story, the background. That being said, I didn't think I had any problems. Why should I? We go on vacations, I play around with my kids. I had no symptoms, not one chest pain, not one tightness, nothing. So as I'm rounding one day, Mary calls me up and says, I have the prescriptions for the calcium score. I got a cup of coffee for you, and we're going to make a date out of it. And I said, leave me alone. I'm rounding. I got work to do, and I'll see you at home. So she shows up at the hospital. And with the prescription says, let's go get it done. For those of you that don't know what a calcium score is, and Peter will explain it much better in detail, it's a simple 5-minute CAT scan. No IVs, no fasting, no nothing. You sit there for less than 5 minutes, you get up and leave. We did it. We had the coffee. We enjoyed it. We went home. And then the test was done. The cardiologist has to read it, and he'll go over that. As I was sitting in the doctor's lounge and I was talking to another cardiologist friend of mine, I said, I just had my calcium score done. He's like, oh, let me take a look at it. Now, we're laughing and joking, and when he looked at it real quickly, his face turned pale. And I'm like, that does not look good. He goes, don't worry about it. We'll discuss it. We'll go over it. Long story short, my cardiologist calls me up and says, George, normal is 0 to 300. You're at 1,400. Instead of doing a stress test, let me cath you. So I said, no problem. Now, for those of you who ever had a cath done, you're awake at it. You're not really sleeping, not sitting there. So me and, Shadi Yun is my cardiologist and a very good friend of mine. We're sitting there, we're talking about what restaurants we're going to go out and eat while he's doing the cath, and I'm talking about a steakhouse. And all of a sudden, we get done. I looked at him and go, any stents? He goes, no, I need to sit down with you and Mary and talk. So he brings us to the side room over there with Mary and says, look at me, and I'm looking and go, I don't know why he wants to talk. Maybe where we're going to go out to dinner or something. He sits down and looks at me and he goes, you have the left and the right side of the heart, and Peter will get into that. The left side is the widowmaker side, as they call it. The left main artery for you is 95% occluded, and the LAD, the left anterior descending, which is the widowmaker, is 98% occluded. Don't exercise, don't run, don't do anything. You're a ticking time bomb. And at 57, wonderful family, wonderful practice, healthy, no problems at all. I just stared blankly at Mary, and she just looked at me and she's like, we'll get through this. So I'm like, all right, what do we do next? He's like, well, Dr. Anderson, Mark Anderson up at Hackensack Meridian is world-renowned at doing these latest cardiac procedures. Let's do a meeting. So my wife and I, she drives me up to meet Dr. Anderson, excellent doctor. We sit down. He looks at all my results. He looks at everything. Like I said, 57, no symptoms, happy as anything. He looks at me and goes, you need open heart surgery. And I'm like, you got to be kidding me. I don't do open heart. I'm healthy. I take care of people. I need to go to work. I looked at him and go, well, how long is it going to keep me out of work? Because I need to go around. He's like, well, we need to sit down, George. Just to make this long story short, 3 weeks later, I'm up in Hackensack getting my chest open. I did what they call a mid-cap procedure, and Peter will go over that with you later. What we decided on was the right side of my heart, the 3 arteries were 80% occluded, and the left side, as I told you before, was 95 and 98. The left side is the widowmaker, so there was an issue where he said, we're going to open you up, we're going to take the 2 arteries from your chest wall, and we're going to do the double bypass. Nothing to worry about. Mary and I were sitting over there, and we're like, are you going to have to stop my heart to do this? Now, when I was a resident, I trained at St. Michael's. I assisted in open heart surgeries. That was one of the things I think I really wanted to do in life, but thank God I did it, but I ended up in ID. That being said, I remember we used to put the heart lifted up, put it in nice, stop it, and you go on the heart pump machine. And he said, yes, I need to put you for 55 minutes on the heart pump machine. That didn't sit right with me, and I remember looking at Mary, and Mary goes to me, whatever decision you make, we will go along with. We will support you. And we talked about it, and I said, I don't want my heart stopped. I felt kind of weird thinking of me laying in OR bed for 55 minutes, pretty much dead, was my theory. And I said, what else do you have? And there was one of the newest techniques where they do a mid-cap procedure. Instead of cutting me straight down the middle of my chest and opening it up, they went underneath my breast over here. They cut 6 inches across, and they spread the ribs apart. And when they spread the ribs apart, they were able to go in with a robot and dissect the artery out of my chest that they were going to use for a bypass, stop the heart with a clamp that only stops where they needed to do the bypass. And I'm looking at Dr. Edson and go, are you kidding me? I go, when I did the open heart surgery, he goes, George, you're old. That was 20-some years ago. And that's when I looked at him over and I go, I guess I am old. Here I'm thinking, I'm in great shape. I'm 25 years old, but I was a 57-year-old man with 5-vessel coronary artery disease on the brink of having a massive heart attack. They did the surgery, spectacular results. Within 4 days, I was home. You were talking about how you take care of individual, you go out, you take care of everything. Well, I had the best nurse in the world. She was with me 24/7. She would lift me out of bed because I couldn't lift up things. And, when you're the caretaker of the family and you're the one that does everything, you sit back and you go, what have I become? I can't move. I'm just sitting over here. But she was amazing. A month later, I went and I got cardiac catheterization, and we stented the right side, the 3 vessels on the right side. And that's my story. Now, that being said, I went back to the hospital after 3 months of work. Caitlin was very nice. I called her up. She went out of her way to make sure that I had very good care up at Hackensack, and everybody was excellent. I go back to work, and you sit at the doctor's lounge, and you talk with other doctors, like, hey, what happened? How's everything? And I'm telling them all my story. And I look at everybody and go, when's the last time you had a calcium score? When's the last time you had a calcium score? We all need to get calcium scores. I think if they had a place to buy stock in it, I think we would buy stock in calcium scores. 2 other doctors are my friends at the doctor's lounge went and got their calcium scores. A month later, they each had quadruple bypasses, and they had no symptoms also. So I sit back and I go, no, I had no symptoms. My friends had no symptoms. Yet this is something that could have killed us. And I know for sure because we go to Greece, and 3 weeks before I had my surgery, we were scheduled to go to Greece on vacation with my family. And I'm sitting back going, what would have happened if we're in an island? And I'm jumping in the water playing with my kids, and all of a sudden I had a massive heart attack. So preventive has become my major thing, and I really appreciate you putting this story together and telling it to the community, because when you become a doctor, you want to help people. If with my story, if we can save even one person, then it's all worthwhile. And Mary's calcium score, I think everybody should go and tell their people at home to go get a calcium score. I do ID consults. I go in and I take care of people. And at the end of every consult, and Caitlin, maybe we can work on this, I'll look at everybody and go, this is what we're going to do infectious disease-wise. This is how we're going to treat you. By the way, have you had a calcium score? And they all look at me like, what are you talking about? I go, I'm not a cardiologist, but I played one on TV a couple of weeks ago. So I'm going to use this as over here. And that's my story. If I can get somebody to get a calcium score, and more importantly, if we all listen to our wives, I think we would be better off. So thank you.
Yeah, pause. Yeah. Let's pause and acknowledge that you're living here today because of your wife and the work that you did. So round of applause for you, Dr. Giannakopoulos. And what's incredibly important is that you're like, I'm sharing this story, as opposed to I'm not sharing this story, and I'm keeping it to myself. So sharing that story, I've said to them, someone's life will be saved today. Don't know who, don't know when, but it's absolutely going to happen. So what's the backstory with what's happening with this fine fellow?
So this is, I wish that Georgia's story was rare. And unfortunately, it's not.
It's way more common than we think, and there's a lot to dissect out of his story as to why we should make it personal and why this should be an issue for everyone to look into their own care. As a cardiologist, I'm way more into primary prevention than I am into having to actually treat somebody on my table, which doesn't make any sense. If you talk to my banker, they'll be very upset at that statement. But it's way more important to attack your personal health issues before they become a problem. You know, so George, and I'm not picking on you. I love this guy. I've known him for as long as I've been in New Jersey. Okay. He said he was getting his heart rate up to 120 every day and exercising and riding his bike and doing aerobic exercise, which is great. The problem is this: he was 57. So 120 isn't where we need him getting to get his heart rate up for what we would look at from a cardiac stress evaluation, because that's a completely I don't want to lose any one of the numbers, but if you want to look at what your age predicted maximum heart rate is going to be, it's 220 minus your age. And then you take 15% of that off, and you get to 85% of your age predicted maximum heart rate. That's where we would exercise you if we were doing a stress test. And a lot of what we do when we're exercising, we're not necessarily pushing ourselves as hard as we should be. And in doing so, we adapt. Our body gets used to being able to perform at a very specific arena where we've gotten used to, this is what we do, this is how long we do it. If you're on a Stairmaster, if you're on a treadmill, I know that my body's gotten adjusted to running for 20 minutes at so-and-so rate at this height. Well, your body can get used to that. And if it does, and you're not challenging it anymore, then disease can creep up on you without you knowing it, which is where a coronary calcium score comes in. It's amazing in terms of the information that you get for what your overall 5-year cardiac risk is. So the first question everybody asks is, I thought calcium was good for you, why are we worried about it being in my heart? And the answer is, I'm not going to bore you with all of the in-depth pathology that goes on. Needless to say, plaque, okay? In its acute phase, when plaque is first forming, it builds inside of the wall of the artery, okay? It's hard for me to show this without drawing it, but an artery is a tube within a tube, and there are 3 layers to that tube, okay? So when plaque first starts to form, it forms in between the inner and the outer layer, in the media, if you will, okay? And the area of that plaque that faces the blood flow is called the cap. So in its infancy, plaque has a very thin cap where it faces arterial flow, and that cap is very thin and friable. It's more likely to rip or burst, which is what results in acute heart attack. As that plaque grows older or matures, calcium will embed inside of that plaque and in the cap itself. In doing so, it shows us that that plaque is matured, so that cap has thickened and is less likely to rupture. But we can see that. And when we do a calcium score, essentially what we're doing is mapping at how much calcium is embedded inside of the walls of the arteries that you have. And then we measured that against an age-predicted individual with the same kind of risk to see where you lie in terms of low, intermediate, or high risk from a calcium scoring, okay? And there's different parameters based on wherever you get that calcium score done. As George said with his test, from 0 to 300 was within normal or low risk is probably the better way to say it, okay? And as you get higher in terms of your calcium score, the higher your risk is going to be. What you don't understand is if you have calcium embedded inside of your coronary arteries, that's only showing us the chronic plaque. And if there's a lot of chronic plaque, you have even more young plaque that's more likely to rupture, resulting in a heart attack. So know your risk. Now, when we have patients come into advanced heart, if they're coming in because they want to know their risk, because they're concerned they have a family history, they have high blood pressure, they have controlled cholesterol, we will order a coronary calcium score. One of the biggest problems that we face is insurance companies don't cover it. Now, I can go down the rabbit hole with you about why that's a truthful statement, but that's a completely different discussion. Suffice it to say, it opens up a bag of worms for insurance companies because all of a sudden they have to start covering things like either a stress test or a cardiac catheterization, which if someone is not having any symptoms, they're hard-pressed to say, yes, you need this or you don't need this. And in the end of the day, the right thing to do is to know what your cardiac risk is. Now, you don't have to go and get a calcium score every year. That would be egregious, and you would be exposing your body to radiation that you don't need. The coronary calcium score gives you a 5-year risk assessment to determine where your risk lies. Once you have that, then it becomes an independent discussion based on what your score is with your physician, either your general internist or a cardiologist. And then you have to dissect and dig down into what your risk is. You have modifiable and non-modifiable risk factors. You know, for George, you can't change who your family is. Some of us may think we want to, but you can't change that, okay? You can't change how old you are. You can't change if you're a man or a woman, okay? What can you change? Well, you have to know what your cholesterol is. And for people with a strong family history, we have to delve deeper. We have to look into whether or not this is a familial hyperlipidemia as opposed to just straight up normal high cholesterol. And there are particulate orders we can look at in terms of lipoproteins. And again, I will not bore you with that. This is an independent discussion you should have with your provider. Okay? Looking at your blood pressure, looking at, do you have diabetes? Are you pre-diabetic? Are you overweight? Do you exercise? What is your relationship with food? Okay, going back to what Taryn said at the opening. That's a very real statement, okay? And it's a different way of looking at the problem that we have with nutrition and overall health, because we need to look into how are we modifying our own cardiac risk.
You know what I want to do? I want to briefly touch on the cost of waiting, right? And then, because I want to bring in Jim Schatzle here, and then bring it back to the type of patient that presents to you, generally speaking, or oftentimes when, with the cost of waiting, Dr. Giannakopoulos didn't wait. Maybe you did wait, maybe 56, 55, 50, right? But because you had the test done, because you got ahead of it, you're here. Thank God. Some folks, even with best efforts, have a crisis in the home where whether it's in Corfu or it's in Monmouth County, you collapse. What I wanted to ask is, when that happens, typically when the cost of waiting, or however you want to describe it, fails, whether it be genetics, life, whatever issue fails, when someone goes into sudden cardiac arrest, what is typically happening, or just give an example, typically organically, and then I'd like Jim, then what brings in your technology and training, which if you're training this already, God bless you, because it matters when it matters. So then once, hopefully, I have a couple of CPR pins, but not many, frankly. If and when, hopefully, that person is resuscitated, what kind of patient comes back to you versus the patient who got the screening, got the scoring, and went in as a stable patient? So you can say, when someone goes down, what typically is happening, chemically and organically, and Jim, pick it up what that intervention looks like with a cardiac, a CPR save, and then bring it back to, as you would say, the table. What's the different kind of patient that is then presented on an acute emergency basis, as opposed to getting ahead of it?
Sure. So I'm going to go at this from this is a plaque rupture state. So the majority of people who have heart attacks, that happens in the field, either at home, while you're driving, and what's going on is one of those plaques has ruptured. And by rupturing, it's the cholesterol inside of the plaque is exposed to circulating clotting factors, which results in a very large clot that blocked flow down the artery. Okay? So essentially what's happening is when you have that plaque rupture event and you have that clot occluding flow, your heart, the portion of the heart muscle that is no longer getting flow is ischemic, meaning that there's no blood flow to it, it's not getting oxygen, and therefore it stops working. And in that moment, when that occurs, it can trigger a variety of different events. Most significantly, it can trigger a lethal heart rhythm called VTAC or ventricular fibrillation. which is what puts you into sudden cardiac death. And this is why, and you know, again, Jim, you can speak to this. Whenever I tell patients that they're having chest pain at home, if they have nitroglycerin, take it. But the worst thing that you can do if you're having chest pain is get behind the wheel of your car. Because now you're not just putting your own life at risk, you're also putting the life of everybody else who's driving on that road at risk, because if you go down, you're going to get into a car accident. The second worst thing you can do is get into the back of somebody else's car, because they don't know what they're doing. They're not going to be able to do CPR on you while they're driving with you in the back seat. And then you've just ruined that person's life because they're going to blame themselves for killing you for the rest of theirs. So that's where what you should be doing is dialing 911 and then having an ambulance or EMTs or paramedics come to your home to take care of you. And that's where, Jim, go ahead.
Yeah. Thanks, Jim.
So grateful to be here today. So this is scary stuff. We're talking about things nobody really wants to talk about until we gather together and just educate a little bit. So every 90 seconds, somebody in America suffers sudden cardiac arrest. That's about 1,000 people a day. It happened yesterday, it's happening while we're doing this meeting, and it will happen again tomorrow. The real horrible thing is only about 7 to 10% of them survive. So there's really two things that we've hit on so far. One is the structural part of the heart, and look where we are. Look where medicine is. I have my calcium score. I'm very happy that it's good, and I'm glad that I got it done, and it was so easy. You just have to do it. What I don't know is the electrical system in my heart. If that's going to just abnormally, or stop working normally, and now I have this sudden cardiac arrest. 80% of people for the first 4 minutes when their heart suddenly stops is in that rhythm known as a shockable rhythm ventricular fibrillation. Those of us that are in this building here, there's AEDs every time you look down the hallway. I can see one across from me right now. That's public access, that's easy to use. So we have great technology, and that technology since 1997 is even getting better, and they keep on adding things that makes it easier and gives you a better chance of survival.
And so talk about the education curriculum that would go into place if folks say, you know what, I really want to leave here doing something. What do I need to do when I leave here? Where do I reach out? What should I be doing? I want an AED. Don't know what the initials stand for, don't know what it is, but it could save my father's life. It could save my mother's life.
Absolutely. First thing you need to do is take a CPR class. They're all over the place. Bayshore runs classes. All the Hackensack Meridian offices run classes. Team Life has classes. Your schools should have classes. So you want to take a CPR class. In that, as part of it, is the automated external defibrillator, which you simply turn it on and follow the voice prompts. Now, so many of my CPR students say to me, I'm not sure if I know if I'm going to do it right. Well, let me tell you something that they've added on to AEDs. So you've seen on TV paddles. We haven't used paddles, by the way, for about 10 years, even in the hospital in the back of our ambulance. They're just pads or electrodes that go onto the patient's chest. Now there's actually a separate piece in that electrode, which is a little sensor. So this goes onto the patient's chest, and the rest of your hands go on top of that. This is measuring if I'm pressing fast enough, hard enough, and coming all the way back up on the chest before I press down again. And that's exactly what we want in CPR. So the AED will actually give you feedback, press harder, press faster, press softer, whatever it happens to be. So things are just getting better and better and more accessible.
So the patient is stabilized and comes in to see you.
So
what's a different type of patient?
This is a constant conversation I have on almost a daily basis in my practice, because I'm usually talking to people who are either active smokers or uncontrolled diabetics, and I make this statement: 30 years ago, you had a heart attack, it's a high probability of you dying. That doesn't happen anymore, because if you get into the hospital, guys like me with a team come in the middle of the night at 2 o'clock in the morning to save your life. The problem is, after that's done, your heart isn't necessarily always going to be in the normal shape it was before the event. You start to develop heart failure, where the pump function of your heart is severely reduced. And then, because you have heart failure, you're drowning to death over the course of the next 10 to 15 years. And it's horrible. When you see people who can't lay flat, who can't walk 5 feet because they can't breathe, because their lungs are filling up with fluid, they become very difficult to manage, and people don't recognize that that's the reality that they're going to live with. So it's a lot easier to bring somebody in before any events occur to figure out what their overall cardiac risk is going to be, to try and help them change before the event. Again, primary prevention. So I'm not here today to get everyone to come see me, because I'm just me, but I think it's important.
But he is just him.
Listen, I'm just a guy, but you need to reach out to your own providers and get evaluated, and then take that, whatever they say, in earnest, because they're not there trying to make themselves feel better. You know, I can do all the hard work I can in my office when I see you and I sit and we talk and we discuss what your personal risks are. The point of the matter is, when you leave the office and you're faced with life again, you make a decision to either own your risk or ignore it. And it's whether you choose to own it or ignore it, you're making a decision that's going to have consequences. And in that, it's hard. It's hard to wake up every day and go exercise. It's hard to change the way that you live, to change your relationship with food so that you're eating the right things, that you're addressing your own personal risk. It's also hard to be on my table at 3 o'clock in the morning naked, getting catheters and wires and stents put in. It's hard to know that your loved ones are in the waiting room crying hysterically. It's hard to watch when your wife, I'm looking at mine now, not yours, is blaming herself because she should have done more to help me. And I see that all the time. Husbands, wives, daughters, sons that blame themselves because they should have done more to help the patient who didn't want to help themselves. So there's circumferential trauma that goes on, and that's hard. Life is hard no matter what you do. The decision is up to you.
And another phrase I've heard is time is tissue, right?
Right.
For those who thought of calcium differently, obviously you're leaving with a different definition today. I'm fairly confident that, hey, look, I have a script from a very famous local cardiologist.
I don't know who that is.
That's from May of 2023.
Wow.
And I failed to get my calcium score done. True story. And the script written by Dr. Farrugia, because life got in the way, expires, I've got a little background on this, after 6 months.
Right.
So I need a new script to not be dead, potentially.
Jeannie, that's very dramatic.
Jeannie, you're on.
So you need to, no pressure, but, right? Good, hardworking people taking care of themselves last. That's why we always shout out, especially to the moms, because they're always putting themselves last, and they need to put themselves first, too, to take care of all these rascals that in the world here. But I wanted to get to an item that ties to, you mentioned calling 911. If you go down from sudden cardiac arrest, you're in VTAC, VFib, how many minutes do you have before it's irreversible and you cannot come back?
Yeah, the Heart Association talks about 10 minutes. And 10 minutes without any oxygen to your brain, things are just not going to go well.
Okay.
Right.
The reason I bring that up is because, say you call 911, you do the right thing, and then you're waiting, and you're waiting, and you're waiting. I know I had
more than 10 minutes.
Right. That's right. So I had a plectron. We didn't have to be in the first aid building, but we needed to be able to get there. By the time I get there to just a basic rig, and I get to the place, you're dead. Now, fortunately, two pieces. One is existing and something brand new that's been launched in the county. We'll talk about that. That's the reason I'm bringing it up. Is fortunately, the men and women of law enforcement are often also first responders, and they're loaded in that trunk. They're loaded already, and they're there first. And so maybe medics are available, but the team is going to get there typically before BLS. But Sheriff Sean Golden and the county just launched MedStar. You want to speak to that a little bit?
Sure.
Because this is to deal with the shortage of I was a volunteer. It's very tough to get volunteers these days. Can you speak to that a little bit? Because time is tissue, right?
Absolutely. So you should all be very proud to live in Monmouth County for many reasons. One of those is our county government, and in particular Sean Golden, our sheriff, and our County Commissioner Director, Tom Arnone, who has invested literally millions of dollars to go ahead and have MedStar, which is a basic life support service that's just going to have more ambulances on the road. It's dispatched right out of the 911 center on Kozlowski, which is our county 911 center. And I'm really happy as a resident and as having my family here in Monmouth County. Heaven forbid if I need an ambulance, the chance that response time is going to be decreased now. So it's really, really good stuff.
Good. Did you want to say anything to that? Or?
Yeah, I mean, so I can say honestly, at our office, we dial 911 usually at least once a week because someone's having active chest pain or having severely uncontrolled blood pressure, putting them in what we call hypertensive emergency. And the first people always to the scene is Colts Neck PD. And they're there to help. And if it was your private home, they're there to be able to help you. And hopefully, if they had to, perform emergency resuscitation before an ambulance gets there. One thing that I want to say, which is kind of a different way of looking at all of this, okay, looking at primary prevention. I'm a parent, proud parent of 4, okay, and when people talk to me about my children and how much I care about them, and I think in general this is the way the majority, hopefully all parents actually think about their children, you would say you would die for your children. And everybody would say that without a challenge because of how much you love them. And I've been changing the way that I talk to people because it's always a challenge. It's trying to break down walls that people put up for themselves as to why they're not taking care of themselves or why they're not going to listen to this doctor drone on about stopping smoking or eating right or anything else, because that's the majority of what we do. You would die for your child, but would you live for them? Because you only die once, but you wake up every day and you have to live. And if that's the truth, then why aren't you living for them? Because we all know our children learn from what we do more than what we say. And we are showing them how to live. And, you know, it's a tremendous amount of introspection to determine whether or not you're showing them the right way to live or you're showing them how to be a bad adult, which means you're not taking care of yourself, you're not exercising, you're eating all the junk that you know you're not supposed to. There's a difference between enjoying something every once in a while in a life in moderation versus just completely giving up. Because you're reinforcing in their brain what they're going to do when they are your age. And this cycle continues. So you have a conscious choice to make to change the cycle that you lived through, that you watched your parents doing, and show your children a better way to live. And that's the challenge. Live for your children. Don't just say you would die for them.
That is incredibly well said. Go.
It is, and how do you follow that? I don't know.
You can't. It's impossible.
You can't. But you know, and Mary says sometimes I'll never listen to her, but it's amazing as I'm sitting here how much she's coming to my brain. When you're in an airplane, my wife always uses this analogy of how you need to take care of yourself. When you're in an airplane, they say, and sure as somebody talks to you, in case of an emergency, the oxygen mask will come down. They don't say put it on your child. They say put it on yourself first. Take care of yourself, and then you can take care of the people around you. And that would be a simpler way of echoing exactly what you said. Take care of yourself, and then you can take care of the people around you.
Thank you. Thank you both. We're going to go around the room, take a couple quick questions, and then we're going to wrap up the podcast with key items that you want folks to bear in mind. And what's your next big thing, right? You want to share that? And you've got a box that's the most incredible big thing. And I also want to make sure that the students that are here today have an opportunity to ask a question as well. Go ahead. Yes, thank you.
Thank you all for being here. Second year in a row, you guys did great. Thank you. The question is, how do you reduce calcium? What are some things we can do if we're still healthy to reduce that?
So I want to be very careful about that statement, right? So it's not, the goal isn't to reduce circulating calcium. Calcium is very important for the body as a whole, for your bones, for other very important cardiac signaling. Really what you're asking is how do we reduce the amount of plaque forming, okay? The problem is once calcium is there, it's not going away. So the goal is, once you identify that you have it, is to stabilize the plaque that you have and prevent more from forming. And how do you do that? Well, it's they say the simple things are always the hardest. So nutrition. Notice I didn't use the word diet. Diet is a 4-letter word for a reason. We've got a ton of them and they're all dirty. Okay? Nutrition, your relationship with food. Exercise, controlling your modifiable risk factors, blood pressure, cholesterol, diabetes. If you have inflammatory disorders, whether it be arthritis, lupus, all of these things increase your risk for developing heart disease. Okay? So it's a matter of getting all of that under control to prevent you from developing more plaque.
The interesting thing is, and just to piggyback, I do infectious diseases. Somebody comes to me with a urinary tract infection, I give them an antibiotic and it's done. Society these days says, what is it that I can do? We're all looking for that silver magic bullet that will take care of everything. When it comes to plaque, when it comes to coronary heart disease, it's not one antibiotic and you're done. It's a lot of risk modifications, like Peter said.
Thank you.
So kind of building off the last question, my mom actually just had a calcium score, had a 52, which I think is pretty mild, but very healthy woman, exercises daily, vegetarian. I don't know if protein, lack of protein has anything to do with that. It definitely is something genetic. So kind of how you talked about preventing it, but in terms of nutrition for someone who's already so healthy and eats well, what else can you go a step beyond?
I mean, if you're approaching things from a nutritional aspect, it's very important to have an appropriately balanced diet. We look for low fat, low cholesterol. So the majority of people aren't coming in, hey, listen, I'm a vegetarian, how am I doing? Because that's a ridiculously hard lifestyle to live. So when people talk about what can they do, it's figuring out the small, subtle changes in your diet, in your nutritional approach that will lead to long-term success that you can live with, right? Everybody here can go on a diet. A diet, is, by its very definition, is a finite length of time to eat in a specific way. And the problem in doing that is the rebound effect after you come off of said diet, okay? Which is why it has to be let's look at what your relationship with food is. What are you eating? How often? What time? It's very easy to dissect from that how to make the changes that will lead to a long-term improvement in your overall health, right? When we talk about, and this is not for your mother, but weight loss in general, when I talk to people about losing weight and getting in shape, the amount of pounds that you lose is not the goal. It's a side effect, okay? It's a side effect we all welcome. The goal is a healthy lifestyle. And that's a continuum that you continue to go after for the rest of your life. The side effect of a healthy lifestyle is weight loss, is improved energy, is blood pressure control, is cholesterol control. That's all the side effect. The goal is a healthy lifestyle. And that's what we need to pursue. So are there foods that she could be eating? Absolutely, right? The problem with vegetarians is that they wind up having to replace their protein sources with things that are either high in carbohydrate, high in fat, which can in and of itself lead to different problems. So that's something that becomes very individualized in terms of her approach.
Thank you. Jean, time for a couple more questions. Thanks.
Hi, I have more of a comment, and I really am thankful that I'm hearing from both doctors the sensitivity to what's happening to the loved ones. You're coming at it from another approach. You're coming at it from what drives us, And so when there are doctors that are talking like you're talking, you're reaching people. So I'm really thankful that you're bringing that into the conversation, but also as a former ER nurse, thank you for reminding people not to drive themselves, because the joke was the worst patients always drive themselves, or the sickest patients have their loved ones drive them. It's really important, and I think everybody here today, if we could just spread that message, it's okay to call 911. We're not burdening the system. If it's not appropriate, they'll let us know, but it's very important to get that help. 911 is not a bad thing, because culturally and in my family, don't ever call 911. As a heart attack survivor myself, who let somebody drive her to the hospital. But thank you for your sensitivity and your approach to the whole family and to what happens after. what does the life look like for that person after? Such an important conversation that we don't hear enough. So thank you.
One of the things that I talk to my patients about a lot is I carry a ton of pain with me from each individual occasion where a patient's on the table, passed out because they've been given enough medication so they're not feeling any more discomfort or pain post-procedure, and I walk into the family room to let them know what happened, to let them know what we were able to do. And the amount of emotional outpouring in that moment where I've had husbands, wives, children collapse on me hysterically crying. And that pain is something I carry with me like a cross everywhere I go. And it's pain that the patient themselves never see or hear or experience. And that's the pain that I try and share with the patients, because unfortunately, I can point to my own data, 90 to 95% of people are back to doing what they were doing to get on my table to begin with within a year of the incident. And it's a decision, whether conscious or not, it's a decision. And they don't recognize that the pain and suffering they're putting their own family members through because of their decision not to do the right thing, and the impact that's going to have on the people they love.
Thank you. It is true, because my procedure was 5.5 hours long. I was out, and I woke up in the operating room, and the anesthesiologist goes, "George, how you doing?" And I looked at him and go, "Well, if I'm in Hackensack, I'm pretty good. If I'm not, then we got a different conversation." But in the back of my mind was always, what is my wife and my family doing outside for 5.5 hours, just waiting?
It's brutal. And to avoid it that's modern miracle of medicine and getting ahead of things as well. The next generation, let's get a question from you, and then we're going to get some final thoughts, and we're going to wish everyone a fantastic day. Hi.
So I agree with what you were saying about how, it's a really big impact on the families, but how do you cope with the emotions of going from case to case with every patient and every family while you're in the hospital?
I don't cope well. I don't. I'm very honest, and I talk to my patients about this all the time. They try and teach physicians to, quote unquote, distance themselves from their patients. That's part of medical training through med school and residency and whatever. And they do that because of the tremendous emotional damage that you can go through by allowing yourself to become too close to your patients. And I will be honest and say it's a double-edged sword, because my patients love how close I become with them. And I've traveled with people for over a decade with their own cardiac journeys. And it's exquisitely hard, because I wound up blaming myself for the mistakes that they've made and the eventual issues that come from those continued mistakes. And it's not easy. It becomes a cross to bear. It's the best way that I describe it. But in allowing myself to become a part of that journey and really develop true relationships with my patients, I honestly believe I can make a difference with them. So despite the emotional pain that I go through with that, it becomes an investment of myself that I'm willing to give, because that's what I think people deserve.
The other thing you got to remember, and your question is excellent, medical school teaches you systems, theories, treatments, and all that. They never teach you the art of holding a hand. 99% of my work is I'm in Bayshore and I'm in Riverview. I deal in sepsis, I deal in the ICUs. Nobody comes to an infectious disease doctor going, "I feel great today, how you doing?" Usually they're about to die, they're in septic shock, their blood pressure is down, what are you going to do? We take care of the patient, but I never forget that I look and there's a family involved with them. I hug, I cried with families. I'm very honest. I always tell them, if this was my family member, this is what I do. You have to. That's medicine. Otherwise, a robot can do it from home, and that's it. There's nothing, they talk about AI that's coming from medicine. I always say, name one AI robot that can hold a hand or hug a family member like I can. That's the empathy. As a doctor, you got to always remember that you need to have that. But there's got to be a part of you that says, after this, I need to go to the next patient that I need to save a life, because if I get too distracted, too emotionally upset, then I may make a mistake on the next case. So don't ever forget that you're a human being and that's what you're dealing with. You know, I always tell people, it's not a burger where if I flip it over and I go, I wanted a medium, you made it well, I throw it away. It's a human being, it's a life. And it's somebody's life, not only you're touching the patient, you're touching their entire family.
Just real briefly, I've unfortunately I've done thousands of death notifications. So I'm with families in their home when I have to tell them some of the worst things they'll ever hear. So for me, and this is important for people at your age and for everybody in here, to keep ourselves healthy, we have to be present. I know everybody's face in this room right now from just the short time that I've been here. And if I've met you personally or not, I'm happy to be here. And I feel what I'm feeling here. So if we're present all the time, we can appreciate the good and get through when it's not so good.
And frankly, individuals who dedicated their lives to saving others are heroes. And we have 3 heroes right here. They may not give themselves credit for it, but all 3 of you are heroes. Thank you. So we have one more question from the next generation here, and then I also wanted to, if Mary, Aaron, you wanted to share a few personal thoughts before we wrap as well, I wanted to open that up to you after this question here. And for other questions, the guests will be here, for a little while afterwards. Yeah.
Yeah, so I wanted to start off by saying, Dr. F, that my father is currently a patient of yours, and I wanted to say thank you for taking care of him throughout his diagnosis and whatnot.
What's his name?
His name is Lewis. I'm sure you've heard of him. I have a question. What can students my age, a junior in high school, do to promote a good heart and a healthy lifestyle?
So that's an excellent question, right? For yourself personally, the best approach is to continue to educate yourself, okay, and understanding, and to approach life with energy, okay? So making sure that you understand what nutrition is, and that's an investment in yourself over time, okay? It's not just, taking one class, it's understanding what drives a healthy lifestyle, okay? And then being an example for people your age and helping people within your family, okay? Through nutrition, through exercise. And, by doing that and by helping other people, that's where you can make a difference, okay? I guarantee, and please don't throw out any names, okay? You're 17, you're a junior or senior in high school. I guarantee if you walk through the hallways in your high school, you would be able to see people that aren't necessarily in the healthiest of conditions. And there are choices that you can make to help them in a non-confrontational way, but, promoting exercise, promoting a change in their nutritional habits because you're trying to help. And that's very important, okay? Seeing people smoking, again, you're at a very unique age. You're a year away from college, or you're going to college in the fall, and you're going to see people doing stupid things, smoking, okay? Whether it be the pen or a cigarette or a cigar, whatever. However you get nicotine into your body, it's bad for you. Trust me. You're going to see people using a variety of recreational drugs because that's the world that we live in. But standing up for a better style of life is how you can help others.
And another item you may have heard about just briefly is it hypertrophic cardiomyopathy?
Yes. Okay. Yes.
Did I get that right?
That is correct.
Okay.
He's so good.
We have an oversubscribed program in Homedale District that was immediately oversubscribed, and we're looking to add additional sessions to do cardiac screenings for kids, and in large manner, a legacy to Jack Dowd, a former classmate of our daughters, who tragically died of sudden cardiac arrest. And so it's that legacy to screen as many children as possible in the district. Should be every district, but And we were talking about that a little bit, so you can promote that. Also, hey guys, and gals, get signed up for that, because that's ongoing right now. It should be in every school, but that's happening right now locally in this district.
Well, they always say, think globally, act locally. You are a very unique point in your life right now. You're young, you're healthy, you're 17, and you're aspiring to become a doctor. When COVID hit, my kids, I would come home, I would be far away from them, we'd be talking. My biggest concern with COVID, other than bringing something, God forbid, home, was there are no family members allowed to visit. People were dying in the ICUs, people were dying on the floors, and their family members could not be there. And, we have 3 kids, like Mary said before, and they were like, well, Dad, what can we do to help? They were in high school at the time, my kids. They're in 2 of them are in college now, one's a freshman in high school. And they came up with an idea called Connect, K-I-N, like your kin, Connect. They fundraised and they bought iPads. And I brought the iPads to the hospitals, to the nursing homes. We donated them, and we said, connect with a family member with their iPhone. If they can't come and see you, and the nursing home or the hospital didn't have the capability for you to look at them, we donated the iPads, and they were able to connect and see their loved ones. That was acting locally. Get a group together with your friends, and I guarantee you will look great for your college applications.
He's not
me
wrong.
and 5 of my friends started this thing called whatever you want to call it, and we were worried about the cardiac conditions in my local area, in my high school, and we put a club together, and we fundraised, and we put together this gym thing that we're doing, whatever you want to do, but act. Do something, even though it may be small, it will end up being something big.
Again, we started off, my wife and our first daughter, who's roughly your age, you stay away from her, but she's a sophomore at SJV, St. John Vianney, and she started because February is Heart Month. That's why we're here right now, okay? She started a fundraiser to try and get healthy foods donated to lunch break. Well, why is that important? So, a big problem is the underprivileged, people who need to go to a food bank for food. What's being donated? Okay, all processed foods, all things that aren't going to be heart healthy, and unfortunately, a consequence of being in that economic bracket is you have a higher risk for developing diabetes, hypertension, high cholesterol, and heart disease. So the things that we're donating are not necessarily the healthiest things for those people. And unfortunately, one of the biggest problems in our society is it's expensive to eat healthy. It's much easier to go to McDonald's. I don't know that the dollar menu is still a thing in today's economy. I haven't been to McDonald's in probably 20 years, but it's much easier to eat cheap, unhealthy food than it is to create something at home, okay? And if you're going to a food bank, the quality of the food that's being donated is not there. So, listen, our office is always open. If you wanted to start an extension of that fundraiser in Homedale schools, or anybody out there listening, if they wanted to start an extension of that in their local town, in their local high school, in whatever group that you're a part of, just drop the food off at Advanced Heart. We're in Colts Neck. It's easy to access because we're trying to change our approach. We're trying to improve our community. It's something that we're very proud of our daughter for doing, but that's something that she's connecting her passion for helping people with her understanding of what her parents do for a living. And it's, as he said, it's an individualized approach. Do something. It's better than doing nothing.
Thank you, Doctor. Jeannie, you have a question in the back?
Hi, yes. So I had a calcium score test done last year, and I'm currently Dr. Farrugia's patient, and I don't know if he knows that or not, but I am his patient. My point is that I'm a little scared about it because I had the calcium score and it was high and stuff. And what is your? And I had the echocardiogram and I had the stress test 2 weeks ago or last week, and now what can I expect now as I move into this further?
So I'm going to make this a generic answer. Okay. The goal is to stop things where they are. Once you've established that you have coronary disease, then we need to make sure that we are aggressively controlling any of your risks, which becomes an individualized approach based on whatever your risk is going to be. You're a man. I can't change that. that is a non-modifiable risk factor, right? But if you have high blood pressure, if you have high cholesterol, if you have diabetes, if you're a smoker, if you're not eating in a nutritional manner, if you're not exercising, these are all the things that we can fix. If you're overweight, believe it or not, having significant increased abdominal fat or adiposity increases your circulating levels of inflammation. And inflammation is the key to heart disease. If we don't control your circulating inflammation, you're going to continue to redevelop coronary disease. And that's something that most people don't realize.
So if I could briefly lean on where the control and power really resides, Mary, Aaron, and Jeannie, did you want to share a few thoughts?
Sure.
Thank you very much.
All right. Well, for one, I'm very grateful, obviously, with the outcome. I'm thankful to my sister for introducing me to what the calcium score is, and I'm thankful that my husband came on that cardiac date with me, and thankful to God that things turned out the way they did. So I love you. I'm thankful for everyone who's here. I really love the expression, it takes a village. I really believe that. I think that, I thank Terrence and Jeannie, who are always in the community, and bringing everyone together and enlightening everyone with such serious issues that, concern each and every one of us. And I also want to say thank you to Mr. Jim Schatzle over there, because I really believe in gadgets and tools. And I feel that if we do have the means, sometimes we need to focus on what's important and really support such devices. There's so much that goes into things that is for our benefit. And I think it's wonderful that we have these opportunities to actually know that exists, so we can all help one another. And at the end of the day, that's what it is. I'm thankful to Hackensack Meridian, the Margaret Thurer team that was up there. They were incredible. They did an outstanding job taking care of my husband and getting him back to us. So I thank everybody. Thank you all. And the doctors, yes, heroes, the nurses, everybody. From beginning to end, everyone's a hero in their own right. So thank you.
Thank you so much. Appreciate that.
And I thank you.
So I just wanted to also thank everybody, because this is a topic that it applies to everyone. And it's not just, again, being a male, overweight, using our poor life choices, but as a woman, heart disease is your #1 killer. And, as a young adult, seeing your mom and dad grow up and being there for them and really supporting them in a healthy lifestyle, it's going to be picked up by your siblings and your friends. So the calcium score really is something universal. I tell my patients every day, it really is a game changer, because it gives you the information for where you stand and how you can prevent future ongoing life-threatening incidences. And it really is a no-brainer. I mean, it is not covered by insurance, but the price is affordable. It depends on where you go. You can go to the hospital, you can go to an outpatient radiology center. It really is an affordable price depending on where you go. So I always tell my patients, don't think that this is going to cost you thousands of dollars, because it really is a small investment into a world of information about where you stand in your cardiac risk factors. And then once we see that as clinicians, we can really guideline your prevention based on what that number is and based on your lifestyle, and together with all that information, make your risk for a cardiac event the lowest it can possibly be. So it really is a game changer. So I can't thank everybody enough for bringing enlightenment to this technology, to this, this universal tool. So thank you.
Thank you very much, Aaron.
Thank you, Aaron.
And I can just piggyback one thing. It's $90. That's what it costs for this test. It's not in the hundreds. It's $90.
I just wanted to, I usually normally don't ask questions, but I am aware of this, but I just wanted to mention it, that a lot of people don't realize that lack of sleep can cause heart issues, correct?
So it's lack of sleep, it's lack of quality of sleep, which is where you kind of go into the sleep apnea concern. that usually causes more significant issues with right heart strain, developing pulmonary hypertension. So it's a different type of issue, but yes, it can significantly increase pressures inside of the heart. Obviously, any time where you're increasing circulating levels of, I don't want to lose anybody, but hormones that are related to stress can increase stress on the heart. And if you're increasing stress, you're increasing the pressures within the blood vessels, which can increase your probability of having a heart attack, right? What's the most common time for heart attacks? Is it on Friday afternoons or is it on Monday mornings? It's on Monday mornings when your stress levels are at their highest, right? So it's understanding that and knowing how to deal with stress, and that's where sleep and taking care of your body becomes exquisitely important.
Thank you for that. And as we bring this home, I'd like to get, first of all, I want to thank again the Monmouth Regional Chamber of Commerce for all the work that they do. And I wanted to ask Jim Schatzle if you can, I want each of you to just a couple quick points for folks as they're getting on with their day and their week, and any big news that's happening. What's your next big thing? If you share that, and then we'll wrap it up.
Sure.
How can folks reach you as well?
I'm very grateful to be a founder of Team Life Incorporated, teamlife.com, where you can learn CPR, and if you're in need of an AED, we can go through the best one for you and take care of that for you. So take a CPR class. Lots of places to do that. I'll be happy to help anybody with that. And also, it's eat, sleep, move. If you tackle those three things in your life and be present at all moments in life, things are better.
Thank you. Dr. Giannakopoulos.
Thank you, Terrence, and thank you for everybody for being here. My message is take care of yourselves. You know, like Mary says, put the mask on yourself first and then take care of everybody else. If you don't do that, you're not going to be around to help the people around you. And listen to your wives.
Happy wife, happy life.
It's 2024. It's happy spouse, happy house.
Well, I was getting gas at Costco the other day, and I was next to a car, and the gas guy, he was talking about how the premium was a little bit different. I go, well, it's my wife's car. I wouldn't bother with premium. I think it's all the same stuff, but let's do it anyway. And he said the price is a little bit different. He goes, well, happy wife, happy life. And this older guy next to the car, he goes, wait, what was that again? And the gas, just the other day, the Costco guy goes, happy life, happy life. Happy wife, happy life. And he goes, no. The thing about the gas prices. So, go ahead.
Virginia, did he put premium or regular?
It was premium, believe me. I don't know.
Got to be premium.
Had to make a difference. Sir.
So I think the next big thing is focusing on the simple things, okay? It's knowing that people know more than they think, okay? It's understanding what you need to do, and sometimes the simple things are always the hardest, especially when it comes to taking care of yourself, nutrition and exercise. They're words that get tossed around by everybody, but it's really what we need to devote ourselves to, okay? People come in and want to know about weight loss, and obviously there's all sorts of new things circulating in the weight loss community. And can they help? Yes, but there are some significant mountains to climb with that, and there are issues that people need to be aware of. So individualized risk factor evaluations, modification, and real meaningful discussions are what is necessary. And it's understanding who you are and what you have to do that will help you live a long and healthy life. Remember, listen, doctors, the goal of modern medicine has been, and we've gotten pretty good at extending your life. So we can give you the quantity, but the quality is completely up to you. So if you want to live a good life, you need to start today. Everything else is an excuse.
Thank you so much for that. And your heart loves you. Love your heart. It's baked into our culture, romance, our physicality, everything about it. It beats every single day. Sometimes you take it for granted. Well, let's not take it for granted and keep on moving forward and keep it beating. And with all of that, I want to thank everyone for being here. And a shout out to our guests. Thank you very much. Huge rounds of applause. And the Monmouth Regional Chamber of Commerce, which is sponsored today by, I'm well trained. Come on.
It's good.
Genesis Orthopedic and Spine and Ethicare. Thank you so much for sponsoring the Chambercast today.
Thank you.
We'll see you next month. Have a great day, everyone. Thank you very much. Thank you,
Thank you.
folks.
Well done.
Good day.
Thanks.